Okay, part two of this series on physical exam. So in this one, we're going to talk about tools that you can use to do physical exam. So first of all, you'll see that my view of them, and I'll explain why. And there's a big reasoning for it, and it's not that those skills are hard to learn. It's not that, and I think I mentioned in a few videos in the past, there's a difference between learning a skills and kind of mastering a skills. And you always have to compare the usefulness of the skills. So for example, it's a little bit like a money. So the skills that I will learn, the return that I would get. So let's think about money. So for example, you're going to, you have to buy a bond or something, or an investment of some sort. And what you're looking for to know, am I going for this one with an investment A or investment B, you're going to look, the money that I'm putting in, how much money do I get back from, right? Well, same things with skills. So the reason some of the skills that to learn about that I will discuss today is that the time, so which is money, so it's just money or time or anything else, or ideas or anything, is an investment. It's just a tool. So it's a way of measuring and comparing something. So if the investment of time in their case, and some kind of money as well, but mostly the time that I would spend on the skills, what would be my return from it? And don't forget that learning one skills doesn't mean that you have that once I've learned it, it's okay, I can put it on the shelves and everything. There's some skills that are kind of like that, but you always have to re-practice those skills. So if you're not going to practice those skills, then why investing in the skills? And then the other question to ask yourself is that, do I need, how much will I get back from it, and only as how much it was going to useful for me. So the skill I'm kind of talking about is using things like blood pressure cuff and stethoscopes and other materials, things like that. So here's my thought of it. They are useful because, I mean, you know, like at the hospital we do it all the time. But they are, so just, we'll start with the blood pressure machine. So we use those numbers all the time in the hospital. I mean, how many, if you ever had if you ever been in the hospital or an emergency, how many times do they take your blood pressures? Kind of, but the number themselves don't mean anything. They're more in the trends. And so if I tell you you got a pressure 140 over 80, or I tell you you had a pressure of 90 over 60 or something, the number itself is like, what do I have in front of me? And this is where they are, sometimes there's way too much emphasis on them than what they bring for. And so the whole physical exam is like a puzzle. So you know, a puzzle that when you have them, so you got a piece and you put another piece, and suddenly each piece together start to make the image that you want, that you see on the box that you want to represent. Well, as you add pieces, and oh, this one needs a round corner over there and stuff like this. Well, this is physical exams, the same thing. So as you do your pieces, you kind of add it on. A lot of people, it seems normal to make you believe that if you have a blood pressure, boom, it's the whole picture, but it's not. And sometimes either they'll deviate your way of thinking from other things. So for example, if I'm anxious or I'm sick, my pressure can be high. It doesn't mean I have high blood pressure. It just means that my pressure is high because I'm sick. So what did the number bring me to my assessment? As you can see, that I'm sick and runny nose and everything like this, nothing. And so we'll talk about blood pressure a little bit more now here. So even from a self-reliance situation, let's say you do have a blood pressure, elevated blood pressure. So let's say we have a pressure for some people that would be elevated above 180 over 110. What are you going to do? Do you have any medication to treat it? Do you really have anything to monitor it? Do we really have anything to monitor and stuff like this? And unless this person has anything to, so chest pain, dizziness or anything, if she would show up in the hospital, we wouldn't do anything for them. We would send them back to their family doctor. You need to have a control of your blood pressure. Blood pressure, as per se, unless we talk about emergency hypertensive crisis, and we'll talk a little bit about this one, is sure you have a high blood pressure, we need to monitor, because the problem is at long term. So it's a little bit like a pipe, right? If I put a lot of pressure on a pipe, at one point this pipe may burst, and this is where they have problem. They may have problem with strokes, most likely, and sometimes a problem with their heart, so they may have heart attacks and things like that. But right now, if they have no symptoms, there's nothing really we can do for them. Then maybe it just tells me there's something else, they're sick, they're anxious, or something like this. To talk about hypertensive crisis, we're talking about blood pressures of the first number, so what we call the systolic, of 220 to 30s, and then the second number is the diastolic, 120s, 140s. So they're a huge number. At that point, when they have this, they have a headache. They have other signs and symptoms. So, and those would be, and then now, the other questions, do I have medication to treat it? If you have nothing to treat it, there's nothing you can do for them as well. And we go back to some of the talk we've been having, that in a self-reliance, limited resource situation, there is some stuff that we could do something in a normal day, so in the hospital or something like that, because those things you would call 911. But if you're in a situation where you cannot have 911, you don't have those things, you do not have the medication, there's nothing you'll be able to do for them, because there's maybe a reason why this blood pressure is that high, and they'll maybe have their strokes, and there's nothing much you can do for them. And as well, there's some literature, for example, if past strokes or after a bleed, to let the blood pressure do her own thing and do not treat it, because the reason is the brain is hypertensive, is trying to bring some things to the head. So some of the case you wouldn't even treat it. That's why would I carry a machine that to see? And I saw many people, so for example, at different levels, so first responders, so firefighters and things like that, got trained on blood pressure. And what happened is that they focus so much on that task, because it's something you don't do on a regular basis. It's something that you will lose. It's easy. I mean, you just have to hear the sounds and everything. But sometimes, like, the sounds don't sound right, or whoops, this one's blah, or their heart rate is low, so you have to use different techniques to kind of hear it. And so if you don't do it on a regular basis, it doesn't come as quick, especially on the sick patient, that you would kind of see it. So I saw many people on the first responder that while this patient is sick and diaphoretic and everything, and still don't have the oxygen, don't do the proper thing as pressure dressings or anything on that, because they're so focused on, I need to get that blood pressure. Well, you don't need to get that blood pressure, because if they maybe they don't have one, and that's why you kind of hear it. So, but there would be other signs for that. So that's why blood pressure cuff for me is kind of out of the kit. First of all, it takes some space. Second of all, it's a weight. Third, most of them also needs adjustment, so you need to have the proper tool. If you lose the tool of that one and you don't have a well-balanced cuff, you just lost your the reason of taking your pressure, because all your pressure will be abnormal. So for all those reasons, I don't believe that taking blood pressure is a useful skill to spend time on and stuff. If you're already an hypertensive person and you are on medication for hypertension, and pretty much every day you're taking your own blood pressure, sure, you already have it at home, so might as well carry it. But I don't see why you would, if it's not that case, why would you learn that skill? But anyway, you didn't learn it for self-reliance. You learned it from everyday uses of the blood pressure. So let's go on the other extreme, low blood pressure. Well, if you take a pulse and you don't feel a pulse at the radial, so right over here, probably the pressure is very low. If you have a pulse over here and no pulse over there, there's been studies that kind of show it. Like, we'll talk a little bit more about that. It's kind of debatable, but the first pulse you will lose is this one. The second one you will lose is the one in your neck, and the third one you will lose is the one in your groin. So as your pressure goes lower, then you can feel it, and as well you can feel it as like. So usually I put them on a scale of 1 to 3. So if you feel it and it boom, 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 that's a 3 out of 3. Versus a boom, 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 that's 3. Versus a boom, 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 that would be a 1 out of 3. So you can even feel the difference between your blood pressure just by feeling like this, and kind of have the pressure is a little bit on the way down or something. And you can see also as their pressure goes down, they're probably going to be more sign symptoms. So no blood pressure cuff in what I think. The stethoscope, a little bit the same thing, but the stethoscope is a little bit more useful. You can listen to lungs, chest, abdomen, so it is useful. It's a little bit the same thing though. You need to practice all the time for listening to it, especially if, for example, you've listened to heart sounds and things like that. And even sometime like now they're talking about listening to the bowel sounds. Not really useful for many of the condition you have, but I mean for respiratory you can use it. But if you're going to buy a stethoscope, buy a good one. So this one, for example, I think is about $200, but again I use them every day. So you want to have one that is not too long, and a lot of times the cheap ones, they'll basically go almost up to your knees, and it's mostly the head as well. Is for those plastic cheap ones and stuff. You won't hear a thing with those things. So if you're gonna buy one, doesn't mean that you have to buy a $200 ones, but they're at least like a $60, $70 good stethoscope to put. But again, you're gonna need. That means that you be prepared to put the time to practice of hearing the sounds and everything. Because just meaning that you have a stethoscope in your kit, what's the point? So. But I mean, it does carry not much weight, has some use to it and things like that. So, yeah, all the other things like ENTs to watch, like ENT for ear, nose, and throat. So stuff to look in the back of the throat, and ears, and the eyes. Unless you're practice and everything with them, kind of would be a waste of time. So, but if you have someone that, for example, can show you how to use it. So if you have a doctor or your optometrist, like, hey, I just bought this machine, could you show me how to use it and everything, and you have good contacts with them, sure, you could maybe try. But again, it's a constant practice for them and stuff. There could be, and there's some good ones that you can buy for about $70 that basically will do everything. So you can watch the ears, you can watch interior of the mouth, the nose, and everything. They could have their useful. The one in the eyes, not so much, because you'll see like it's not that easy to watch unless you watch it on a regular basis and stuff. And most of the conditions that will encounter to yourself, you'll be able to use it. The last one, and we'll do actually a full videos on that one once I have a little bit more material coming in, is some diagnostic imaging kind of, so diagnostic tools that you can use. So urine, sputum, so basically all stuff that can come, stools, sputums, liquids, a little bit of blood. It can be useful, and we'll do a video on all that ones, and those ones can help you, but again, in that little 5%, just to almost a little bit confirm more what you're suspecting, and kind of you're on the edge of between two, then it can help you and stuff. So hopefully that was helpful, and I'll talk to you soon.